Takayasu's arteritis, also known as pulseless disease, is a rare and chronic form of large vessel vasculitis. It primarily affects young women and involves inflammation of the aorta and its branches. This video will cover all aspects of the disease, providing a comprehensive understanding for medical professionals. Takayasu's arteritis is a condition where the aorta and its major branches become inflamed, causing narrowing, blockages, aneurysm formation, and subsequent complications. The immune system plays a key role in this process, with various pro-inflammatory chemicals contributing to the activation of inflammatory cells in the blood vessel walls. These cells release more inflammatory substances, leading to damage to endothelial cells, abnormal growth of smooth muscle cells, and fibrosis. The exact cause of this immune response is not completely understood, but there may be genetic, infectious, and environmental factors involved. Takayasu's arteritis can present with pulse discrepancies, constitutional symptoms, and bruits. Organ involvement can lead to symptoms related to dysfunction. Accurate and timely diagnosis of Takayasu's arteritis is crucial for initiating appropriate management strategies. The American College of Rheumatology has established classification criteria, which include specific clinical, laboratory, and imaging features. These criteria aid in distinguishing Takayasu's arteritis from other forms of vasculitis and assist in facilitating consistent data collection for research purposes. The criteria consider various aspects, such as age at disease onset, pulse abnormalities, blood pressure discrepancies, and angiographic findings. While angiography remains the gold standard for assessing vascular involvement, non-invasive imaging techniques, including Doppler ultrasound, magnetic resonance angiography, MRA, and computed tomography angiography, CTA, have an increasing role in establishing the diagnosis. Imaging techniques such as Doppler ultrasound, MRA, and CTA are used to assess the extent and severity of vascular involvement in Takayasu's arteritis. They provide detailed images of vessel wall abnormalities, stenosis, and aneurysms, helping in the evaluation of different arteries. In summary, laboratory investigations are essential in diagnosing and monitoring Takayasu's arteritis. Inflammatory markers like ESR and CRP may be elevated, but clinical findings should be considered. Autoantibodies are typically negative, and ancillary tests help assess systemic involvement and exclude other conditions. Takayasu's arteritis follows a highly variable and unpredictable disease course, with periods of exacerbation and remission. It can result in significant morbidity and mortality, particularly when there is involvement of vital organs or extensive vessel damage. Complications associated with Takayasu's arteritis include aneurysm formation, thrombosis, occlusion, and subsequent ischemic events such as stroke, myocardial infarction, and renal dysfunction. Long-term outcomes largely depend on the promptness and effectiveness of treatment, as well as the extent and severity of vascular involvement. Regular monitoring and follow-up are essential to detect and manage complications early. Differentiating Takayasu's arteritis from other vasculitis syndromes and conditions presenting similar clinical features can be challenging. Giant cell arteritis, another large vessel vasculitis, may share certain clinical manifestations, including pulse discrepancies and constitutional symptoms. However, it typically affects older individuals and often involves the temporal arteries. Other conditions on the differential diagnosis list may include atherosclerosis, fibromuscular dysplasia, and various connective tissue diseases. Thorough evaluation, including clinical assessment, laboratory investigations, and imaging modalities, is crucial in reaching an accurate diagnosis and initiating appropriate management. Medical management forms the cornerstone of treatment for Takayasu's arteritis. Glucocorticoids, such as prednisone, are typically used as the initial therapy to suppress the immune response and reduce inflammation. However, long-term steroid use is associated with numerous adverse effects, and efforts are made to minimize their dosage and duration. Immunosuppressive agents, including methotrexate, azathioprine, and mycophenolate mofetil, are often added as steroid-sparing agents, aiming to maintain disease control and reduce the cumulative steroid dose. Biologic therapies, such as tumor necrosis factor inhibitors, for example, infliximab, have shown promising results in refractory cases or severe disease manifestations. In some cases of Takayasu's arteritis with severe vascular involvement, interventional procedures may be necessary to address stenosis or occlusion and improve blood flow. Endovascular techniques, such as angioplasty and stent placement, can be employed to dilate narrowed segments and provide structural support to weaken vessel walls. Surgical interventions, including bypass grafting, revascularization procedures, and endarterectomy, may be required for complex or extensive disease involvement. These interventions aim to restore blood flow, relieve symptoms, and prevent potential complications. The choice of intervention depends on various factors, including disease severity, anatomical considerations, and the expertise of the treating team. Given the multisystem involvement and potential complications associated with Takayasu's arteritis, a multidisciplinary approach is essential in managing this complex condition. Close collaboration between rheumatologists, cardiologists, radiologists, vascular surgeons, and other healthcare professionals ensures comprehensive care and optimal patient outcomes. Regular interdisciplinary meetings facilitate the exchange of information, aid in decision-making, and promote a holistic management plan. The involvement of patient support groups and resources also plays a vital role in addressing the psychosocial aspects and improving overall quality of life. Takayasu's arteritis can impact fertility, pregnancy, and contraception in reproductive-aged women. Disease control and management are key. Close monitoring during pregnancy is crucial to identify complications. Contraception counseling is important due to potential risks of hormonal contraceptives. Ongoing research is helping us understand the complex causes of Takayasu's arteritis. Studies are investigating how specific molecules and cells contribute to the disease, and new treatments are being explored. Collaborative efforts are crucial for improving patient outcomes. In conclusion, Takayasu's arteritis is a complex disease that requires a multidisciplinary approach for diagnosis and management. With ongoing research, we can improve patient outcomes and quality of life.